My whole life, I thought the perfect body was just one decision away. In cities like Miami, perfection glows in neon. Billboards promise curves. Screens promise confidence. The dream is everywhere. You scroll long enough, and it starts to feel normal. Tiny waists, perfect hips. Before and after photos that look almost magical. But filters don't show what happens after the camera turns off. I'm not alone in wanting more. More confidence, more attention, more approval. And when everyone around you looks transformed, waiting feels like failure. In 2010, a woman saw a different kind of promise. $700 for a Brazilian butt lift. 700, not thousands. Not months of saving. Just one payment. But the procedure wasn't done in a hospital, not even a real clinic. It was done in a small apartment. Peeling walls, a folding chair, a flickering light overhead. What filled the syringes wasn't medical-grade filler. It was cement, mineral oil, superglue, even tire sealant. Materials meant for construction, not for human bodies. The woman holding the syringe promised instant curves. She sounded confident, experienced, convincing. And desperation doesn't always check credentials. The injection was quick. The results looked immediate. But inside her body, something unnatural had begun. Within days, her skin hardened. Swelling spread. Pain intensified. Her body was reacting the only way it could, with inflammation and infection. Doctors would later say no licensed professional would ever inject those substances. Ever. And still, others lined up. Because the price was low, and the dream felt worth the risk. Until it wasn't. Fast forward to March 7th, 10:26 p.m. That's when 28-year-old Amonique Miller took her last breath. Earlier that day, she underwent a BBL and liposuction at a busy cosmetic center. High demand, fast procedures, tight schedules. In some places, surgery can start to feel like an assembly line. After the operation, she wasn't taken to a hospital. She was transported to a recovery house, a normal suburban home. It looked safe. It looked quiet. Inside, patients rested in bedrooms, recovering, waiting. But recovery after major surgery isn't passive. It requires monitoring, attention, medical oversight. Police later reported there were no licensed medical staff present, no proper supervision, unprescribed medications scattered nearby. And when complications happen after a BBL, they can escalate fast. Fat embolisms, blood clots, internal bleeding. Minutes matter. Time is everything. Authorities found signs suggesting she had been gone for hours before emergency services were contacted. Hours in a quiet room with no one checking. Behind every headline is a family. A mother waiting for a call that never comes. A phone that stays silent. A future that stops without warning. But Florida isn't the only place where shortcuts turn dangerous. In Brazil, one cosmetic surgeon built a massive following online. His nickname was Dr. Bum Bum. Catchy, memorable, marketable. He promised dramatic transformations, celebrity curves, confidence in a single session. Patients trusted him. But some reports alleged he used substances like silicone and acrylic fillers, materials that can become deadly if injected into blood vessels. During one procedure, a patient suddenly became critically ill, her body reacting immediately, violently. Instead of calling emergency services right away, he fled. For 5 days, authorities searched for him. A surgeon, on the run. He was eventually arrested. But arrests don't rewind time. They don't restore breath. They don't repair families. Different cities, different doctors, different victims. But the pattern is the same. Low prices, fast fixes, big promises. When profit grows faster than regulation, safety can fall behind. Social media shows the results, not the risks. Filters blur reality, discounts hide danger, and perfection starts to look easy. The question isn't whether someone wants to change their body. That desire is human. The real question is this: Are you willing to gamble your life for the discount version? Beauty is often described as pain, but pain isn't supposed to kill you. Shortcuts don't always save time. Sometimes they end it.